everyone, and welcome to the first session of our Environmental Justice Symposium. I am Mayra Ryder, Project Director with Farmworker Justice. This first session is going to focus on the health challenges of farm workers impacted by climate change. Our presenter is Dr. Marysel Pagán Santana from Migrant Clinicians Network. The first section of today's session is going to be a presentation by Dr. Pagán. If you have any questions for our presenter during the presentation, please feel free to put them in the chat. After that, we're going to have a section for discussion. We're going to go into breakout groups, and we will give you more instructions for those after the presentation. And now, without further ado, I will hand it over to Dr. Pagán.
Thank you so much. Mayra, can you please, if you allow me to present? Perfect. So as Amara was saying, my name is Marysel Pagán Santana. I'm a doctor in public health and senior program manager for the Migrant Clinicians Network located in the Puerto Rico office. I would like to discuss some of the health challenges farm workers go through when they get impacted by the climate crisis. So we can have a really good discussion on the breakout groups about the best practices and some of the options that we have to mitigate those impacts and support this population through this process. First of all, I wanted to introduce you to Migrant Clinicians Network, or MCN. MCN is a national collaborative agreement. We work in towards our mission, which is to create practical solutions on the intersection of vulnerability, migration, and health. We provide technical assistance and training and other types of support to communities, health workers, community health workers, and workers overall. We are located, we have 4 offices and we're located throughout the states, kind of like remote satellite workstations. In Puerto Rico, we do have an office in Maryland, California, and Texas, but you can see that we have support staff throughout the states in several areas. MCM usually serves immigrants and migrants and other mobile populations that can be vulnerable. We work with stakeholders like health departments, community health centers, clinicians. And when we talk about clinicians, we're talking about from physicians to a community advocate, health educator, community health worker, basically the whole service health provider staff. It's not only the physician, but all the persons that interject in the journey of getting health services or staying healthy in or outside of a healthcare institution. So when we talk about climate change, we know that climate change or the climate crisis is making extreme weather more common and deadly. It brings more dangers to the work that we at some point thought as safe, or can be make even more dangerous work that usually is not as safe as we would want to, or we haven't get or work out policy or standards and regulations that provide a safe environment for workers. In the past 7 years, we have been seeing the hottest days and records. We have seen heat waves over the summer. And we have seen from tornadoes to flooding to hurricane affecting those who usually work outside and are more vulnerable, like farm workers. When we talk about how you can be or who is more vulnerable and why we are more vulnerable to some of the exposures, we have to look at the process and what we have in our environment. So we can go from environmental stressors, which is what we're seeing with the climate crisis, the systems that are in place and have an impact in the way that we can access to health or have policy in place or have support to actually get services or help or support. And ultimately the health outcomes, whether they're good or bad, if you don't have the systems in place or we have inadequate systems, you're not going to have the health outcomes that you would like to. So when we look at agricultural workers and climate, we have to look at the whole environment systems before actually thinking that it's just a kind of like an input and output type of situation. One of the environmental stressors that we've been talking about is extreme heat, and we know that extreme heat kills more people than hurricane, flooding, tornadoes, and lightning combined. We know that the projections that we have is that we're going to have an increase in the average of hot dates, and we will likely see heat index that we will exceed the 104 degrees. So making that while we are seeing that, we're seeing the heat increase, we're seeing the what heat can do over people. We're not seeing national standards or systems regarding training or programs centered around heat prevention. So we have an environmental stressor like heat, but we're not seeing systems in place to actually address that. In terms of farm workers, the CDC states that farm workers are 20 times more likely to die for heat illness than other US workers. So when we're trying to put in context of how that stress or environmental stressor affect farm workers, this is what we're looking at, 20 times more likely to die. And I want to go around some stories from the field so you can put into context what we're talking about. It's just not about regulations, it's about systems and support and what we can see in the day-to-day from farm workers. This is a story from Marysel, a story from the field. When you have experience from farm workers that have experienced seeing other colleagues or staff or employees suffer dehydration or illness, seeing people faint in the fields, seeing people that that are having histories and they were not taken care of, either before in a preventive measure or after they will having or notifying that they're having the issue and having the histories going on. So having that is not only the people who suffer the histories or the heat stroke situation, but also the employees that are seeing how that's being managed, and that has a connotation and effect eventually when we talk about systems and what's in place and what best practice there are. You see farm workers seeing how that situation is managed, and what creates is fear and hopeless in terms of notifying and being able to control that in the field. There's another story from the field from Miguel again, seeing that they are reporting not having breaks. Some of the guidelines that we have seen from experts to manage heat stress and heat strokes and heat overall in the field is having breaks, is having water, is having some place to protect from the sun, and even the adequate equipment and clothing. So understanding that in addition to the already vulnerable situation in terms of low pay and other characteristics of this population, having employers who are not allowing breaks or not allowing water breaks, and being scared of losing your job is one of the factors or systems in place that can worsen the situation in terms of the climate change. Another environmental stressor that we can see is the wildfires. We know that when we look at areas like the Western United States, California, we know that we have a really big area of farming that is it can be affected by the change in wildfires. Wildfires are also projected to increase. The environmental conditions like temperature, humidity, and other are likely to be, let's say, perfect to provide for wildfires to continue to happen and to increase the areas that we're that are getting burned. So what happens when you have wildfires and you don't have system in place in terms of emergency preparedness and response for farm workers. When you have farm workers that fear to leave areas where they're being exposed to fume and smokes, even though everybody else is basically evacuating the area. So there's another story for the field to put in context. We see in a lot of the featuring of these workers saving, and if we look at that too when we saw COVID-19, we look at essential workers and we kind of like see the heroic piece of it, in terms of being there, being exposed at work, being able to be essential and provide for the food chain to basically continue and for us to have food security. But at the time they're being exposed or being put in a situation where their lives and their health are vulnerable and are impacted. So thinking about how we can see it out being portrayed as heroic, but at the same time it's just a necessity for farm workers, is also some fear again to lose their jobs and not be able to actually sustain their families while there's an emergency going on related to wildfires. In terms of atmospheric disaster, we do have similar story with the recent hurricanes, either Puerto Rico, Nicaragua, Honduras, and Virgin Islands. We know that basically these are farm workers that are exposed to flooding, landslide, and other types of impact related to the hurricanes, in addition to being in areas that are not usually really connected to the services. So we have farming. If we look at areas like Puerto Rico and Nicaragua, you have really rural areas that can become isolated and not connected to another emergency service while there's some kind of a hurricane or storm going on. In addition to that, there are going to be ones that we are past the storm. There's other environmental factors to taking place and stressors like unsafe water, debris, and other pathogens like bacteria that can be in place and they can be exposed to it while doing their work. So this is just about the hurricanes near far and the landfall of the hurricane in Nicaragua and between Nicaragua and Honduras. And the significance within this is that it created to a displacement of people when they're trying to do their work. If you got disasters like this, you're going to have some of the crops and harvests being affected by climate change and create some kind of migration or displacement to other areas. So this is a population that is not only losing their job because of the climate change, but also being exposed to the impact and dangers of events like wildfires, like flooding, and at the same time being exposed to some new vulnerabilities when they have to move away from their home. Another story from the field, this is in Puerto Rico. Like I was saying, some of the issues regarding atmospheric events or hurricanes and storms are regarding the accessibility of where the housing and the farm areas are and how accessible are they for support or even emergency response teams. So a lot of the roads in Puerto Rico leading to the areas where farm workers live were blocked, and they were not receiving services even after 10 days of being in the emergency. That meaning that even for people who were needing an ambulance or an emergency medical attention, there was no way to get there. So that's when it comes to not only losing the job, but also being the demands of requirements of the job makes you have to be in a place that is mostly isolated, or that it has is not as easy to get. And the roads become an issue. So not having a system in place to support emergencies within the community that can be immediate and that can be accessible to this community is also a problem when we're talking about emergency preparedness and response. So when we talk about who are the most vulnerable to all the environmental stressors that we were talking before, we talk about people who are working outside, people who had lower socioeconomic status, children, pregnant women, chronic illness, and migrants. And in some of the weight, if you look at some of the statistics about who the farm workers in the US are, you can see that they're not only working outside, but they have a really low socioeconomic status. They might be migrant. They're mostly migrant, and they also may suffer from some chronic illness due to the same exposures that they actually work, like pesticides or even the smokes during this type of wildfires. So other than the characteristics of the people who actually work in farms, you can see, you can see that there are some barriers that kind of get mixed up with the systems, right? So you get to a place where you're trying to work and there's an emergency going and there are some systems in place for people who are native speakers in the area. So when you are a farm worker who is also a migrant, you will have cultural and language difference. We can see in the statistics the low wage, some of the dangers of their own occupation, the immigration status, and specifically the lack access to healthcare or insurance. So not only are you exposed because of the work that you do, but also because of the situation you're in when in the place that you're working. And some of this stuff may seem kind of redundant in terms of we already knew this, but they're really essential. We're talking about dealing with climate change policy and emergency preparedness, because they can be the difference between understanding kind of like an evacuation notice, understanding your rights, and making sure that you're not exposed to what other people think is something that we should know how to prepare to and how to work with. Structural and system issues that we can see, and this is the part about the systems that we have in place and what we can have around being an agricultural worker living in climate crisis states. So we have regulatory issues we talk about, and there's a few slides about the worker protection and heat standard. We have immigration, discrimination, language, and continuity of care. Continuity of care and regulation issues are two of them that two of the systems, including language too, that can be solved when we're working with communities and stakeholders who address emergency preparedness and climate crisis mitigation. Because we can deliver public policy, we can deliver regulations, and we can prevent some of the impacts that agricultural workers are having because of the climate change. In terms of worker protections and the policy piece of it, only a few states have heat stress standards. And remember, we talk about having the environmental stressor of heat being one of the issues that we have with climate crisis. We don't have a federal heat standards. We have some states that have standards, but we haven't been able to get to a specific national standard, federal heat standard, to address heat, and therefore the what it comes with climate change, the heat projections that we're seeing. We have some initiative that have been trying to get towards that that standard policy. The Asociación Valdivia Heat Illness and Fatality Prevention is one of them. This worker was exposed to over 100-degree temperatures while picking grapes. And instead of calling an ambulance, the employer decided to send the worker with a family member. So this person was not receiving did not have any preventive measure in their work. Second, did not have their accurate or corresponding response, emergency response to treat the heat strokes, and sadly died, and something that was completely avoidable, and that we can prevent to happen again. And we know that it still continue happens in other persons and other workers, and we kind of know that doing the public policy piece and having a heat standards will avoid us to keep repeating this story. The act still not in place. We're still waiting for Congress to take action on it. But we know that some efforts regarding the heat standards is still going on. The other piece in terms of the systems, and this is more specifically when you have already seen some of the impact and consequences of climate crisis, or even your daily job task, having healthcare access that has adequate language, transportation access in terms of insurance, understanding and cultural appropriate services can be the difference between having a farm worker that does not have a good health or survive, and somebody who actually receives services. So when we're talking about modifications and systems to have in place, we need to understand that we're gonna see consequences of the climate crisis moving forward, and impacting the health of the farm workers, and we have to have healthcare institutions to be ready to actually understand the characteristics and the needs and the risks of farm workers to be able to actually give service to them. So community health centers are really important in this piece, also the community health workers, in terms of adapting programs and to be sure that we understand what the risks are for these members, and also the mobility and displacement piece. This is something that we can see in the best practice for some of the California stakeholders groups, how they actually address being displaced by some of the wildfires, and what that means for somebody who does not have or does not speak the primary language of the area, and how they can navigate the system. But also healthcare institutions have to be ready to actually be able to promote that the person can be mobile within healthcare facilities and still continue their services and their procedures or whatever care they need in terms of the illness. The other systems that we need to have in place when we're talking about climate crisis is the emergency planning and response. This can be the difference between having people working while the emergency is taking place, and the outputs of that emergency, and the how they can be impacted. So we saw that some of the discussions regarding intense meteorological events like the tornadoes, and how the employers are not implementing any emergency planning or response that is adapted to climate crisis, can be fatal for some workers. It also was shown during the wildfires, and some of the situations during the hurricanes in Puerto Rico, about how the lack of an emergency planning in the workspace or work environment created a new risk for employees, and had that situation going on for them. So one of the things that we have to make sure is that evacuation information and training in the appropriate language is taking place, and that is not a one thing or one-time thing that you can do. Is something that you have to do recurrently, especially if you're receiving seasonal workers that can be exposed to different emergencies depending on the season that they're working or where are they located. The information and other type of the systems that we are having issues with, and it can be impacting farm workers, is the eligibility for services, and that meaning emergency response services, or even insurance for housing that they lost, or having some support because of the lack of food at some point can be some of the impacts that we are not considering when we're talking about systems and climate crisis. Housing and camps infrastructure too. We can see that some of the housing and camps are not don't have the best infrastructure to sustain flooding or other types of really intense events in terms of atmospheric events. So that's something that it becomes more vulnerable the farm worker to have to lose housing, to lose the area where they're sleeping or living, and the access to healthcare during and after. Not only because of what we talk about in terms of the distance between the health services institution and how distant can be the housing or their camps in terms of accessibility, but also having healthcare institutions that are also ready to sustain these events and are able to open. Sometimes we see that the institutions that have less resources and less systems to support their emergency planning and response are the first to close, and the populations that usually get affected by this are populations that are already vulnerable and they actually need some really quick and immediate response in terms of the healthcare institution. In terms of the outcomes and the specific health outcomes, there's a variety of those, but we can focus on 3 of them. Mental health. We have been doing some work with some of the communities of farm workers in Puerto Rico. And a lot of the work that we have done is kind of understanding how they can take care of their mental health with the healthcare institution, in terms of knowing that one, climate crisis is projected to continue, that we're going to have some of the events again, and the fear of losing crops and harvests is still, or your job or your house is still something that you get to live, especially with areas that have hurricane seasons. They have their expectation is that this risk or this event may occur every year. Chronic disease, not only for those who have chronic disease that are not related to their work, but also can be impacted by climate change and not being able to get help, but also those chronic disease who get developed because of long exposure to heat or inadequate or sustained exposure to smoke if you continue to work under situations like wildfires. And ultimately that, like we talk about the histories and other working situations in terms of employees kept working during these extreme events. If we don't work towards getting systems or policies in place, we're gonna keep seeing some of the fatal results of not having that systems in place. So in terms of best practice and how we can address this, it's not just about knowing what we know. It's not just about talking about the histories on the stories in the fields. It's about how we can identify best practices, who are the stakeholders that can support these best practices, and what stories we already have of some of the groups that are working towards addressing climate crisis and the impact that it has in farm workers. So one of the things that we have to work is a cultural adaptation, and that goes not only for SOPs or system in place to address work prevention, but also for do emergency preparedness and healthcare services. We need to address the availability of those products and resources in the cultural they can be cultural adequate. They can have the language available for the people who are not native speakers to the area that they are in, and also the literacy level has to be adequate for people to understand what they're being told and be able to do in response to it. The other piece of that is working, and we know it works, is the community mobilization piece. Understand the stakeholders who can be there to support these workers, and how can we build bridges between those stakeholders and the agencies to actually support emergency preparedness response and climate crisis adaptation. And the other piece is having appropriate service delivery models that's not only for healthcare institutions, but also to people providing training and support to farm workers' health and safety, understanding that they may not be in the same place for a prolonged period of the time, and they might be moving to another place with another risk. The other piece is to having people to get to the farms rather than expecting farm workers to get to areas that may seem unreachable to them through our outreach workers. And the last piece is basically going through some of the experiences and in highlighting some of the best practice that we have seen addressing these issues and other related to that. One is the farm workers care preparedness and response efforts in California. This was created in 2017, and basically what the care system did was to get together leadership from the community health workers, and even part of the farm workers to get trained on emergency preparedness and response, to understand the system and how they're supposed to be addressing basic health issues and safety at works, and including even where to look for support when some emergency was going on, like for example where the shelters are, where the food bank are, fire station, relief agency, and how to navigate that. So building that community to be able to understand the system where they now are working in, and to navigate that system and to actually use the system to be able to get support was one really significant effort being carried out in California, and that actually late 6 or 3 to 6 years later was proved to work and was put to work because of the wildfires showing up again. In Puerto Rico, we have seen community mobilization through the community health centers. This is one of the programs that MCN led for the last 3 years with a community health centers in Puerto Rico. This program was built upon the looking at how the health centers responded and how they're building up in the relationship with the communities. We continue to work that process in a way that we get communities to create the community health their community emergency preparedness and response plan. And those are communities that are in rural areas that are mostly farm workers in response to what happens during Maria and their risk to be for that to happen again. And lastly, we had another program that, even though it's not directly related to the climate crisis, it was in response to COVID-19, but we also saw how some of the initiatives and programs that they have been building to address COVID-19 are now moving towards workers' health and safety, especially with farm workers in the U.S. We had Alianza Nacional para Campesinos with other stakeholders, work with community health workers to address vaccination, health and safety in the work, and other protective measures against COVID-19. So having a community mobilization model to address and empower, this is not about just giving the responsibility to the communities, but also to empower those in the community to navigate systems and to be able to advocate for changing policies is also part of the process. So getting support to understand how to address climate crisis and to address the impacts that it may have in your population towards and build that community bridge to that goal in terms of mitigation and response, but also to create the bridge with agencies and other areas to actually move towards policy in standards like the HEAT standards and other types of programs and training developments to address the impacts is really important. But it does starts, and one of the best practice and successful practice is to start with the community and then move forward to the needs that we have in terms of regulations. We do have some more information in our webpage. So, and we have several programs related to climate crisis and environmental justice with communities to address climate and farm workers. So I invite you to just connect with us at MCN and go through our resources and updates at the field, or just go to our social network and see what we're doing. Thank you.
We saw that at the end of the presentation, we had a question for Dr. Pagán Santana that we would like to address now. If you have any additional questions, please put them in the chat, and we'll take a couple of minutes to address those. The question was, does FEMA have any plan for addressing farm workers specifically?
So, to my best knowledge, there's no specifically work plans addressed to farm workers, and that's because FEMA roles is more into the preparedness and emergency. In other areas, in community, they do community mobilization with various types of communities. One of the limitations that we see when we're looking at FEMA and other agencies related to emergency preparedness is that they see agriculture as a food security issue, and they talk about the product and the harvest and the crops, but not about the people who work on them. So you can find guidelines addressing mitigation and prevention for the crop being resilience and the way that we harvest and we work farms as a way to maintain and support food availability through an emergency and climate, but we don't address the human resource behind the issue. And that is similar for the response and mitigation agencies that work after in the recovery piece of the system. Like we see a lot of incentive or maybe grants going towards sustainability of crops and mitigation of crops and resilience of crops, but there's not a lot towards the human resources behind that process.
So it's focused on business continuity and the
Yes,
food chain, basically.
Correct.
Yes. So I'll give one more moment. If anyone has any additional questions, please put them in the chat. But I would also like to request that everyone fill out an evaluation poll that we have for this session. And you're going to be seeing that link in the chat in just a moment. As we wait for any more questions, I would like to request that you give us your feedback, because that will help us improve our activities in the future. So there is a comment in the chat. This seems linked to something that a person in California just shared regarding farm workers being sent into wildfire evacuation sites to harvest.
Yes, and I see a follow-up question in terms of any steps that we can take. There are standards and regulations that are on the OSHA actually field rather than FEMA when talk about emergency preparedness and disaster response. And there's an obligation for employers to have those plans in place to protect workers while there's some emergencies going on. So it's not just about knowing how to manage yourself when there's an emergency, but also in your workplace should be ready and have steps to protect you. And that applies to farm workers. While some of the events that we're seeing, what we need to, and the action that we're asking to take, is that we need to move forward with those plans that were made maybe 10 years ago, 15 years ago, are not up to date in terms of how quickly an event can form, how quickly you can have something like tornadoes, or how frequently we'll have wildfires. It's not something that happens once every 2-3 years, something that may be happening more than once in 1 year. So we need to advocate for having climate change related emergency preparedness plans from employers, and not only for agricultural workers, but other workers as well. Those warehouse that we saw in the areas that the tornadoes were hit were also vulnerable populations that were not having emergency response in place. And there's also the advocacy for the heat standards that will help out a lot of the issues that we're having regarding heat stress and heat strokes and farm workers.
Yes, and we know that many people who are on this session today are working for organizations that are advocating for those rules. We are going to transition to our next session, which is the wrap-up with a report from the discussion groups that we did in the breakout rooms. So I am going to share my screen. And we will go and take a look at what you just shared on the Miro board. So regarding our first question, which was initial reactions and thoughts after the presentation, one person commented on the lack of governmental interest and care in passing heat-based illness legislation. And this highlights the disparity that farm workers and people in other outdoor jobs are experiencing, which is related to what Dr. Pagán Santana was mentioning just now about the heat rules. And another attendee commented that more needs to be done to protect farm workers as we are seeing extreme climate changes. And we have some excellent feedback about Dr. Pagán Santana's presentation. And this person also says that I knew about climate change having an effect on places like the dry corridor in Central America and causing extreme hurricanes, but did not know that more workers die of heat-caused illness. And those disparities in terms of the death rates for agricultural workers are really, really stark. And going to the next question, which was the one concerning the community experiences and what participants have seen in their organizations and in their work regarding the effects of climate change on farm workers. One person says, in my experience as an organizer out in the fields, farm workers have been greatly impacted by climate change in the way that extreme weather, hot or cold, decreases production, and so decreases their earning power due to no unemployment benefits, and or increases the possibility of injury due to the weather. So again, heat exhaustion and heat illness. And then another participant says this is not from an organization experience, but they have learned from a friend who is a journalist that in the Central Valley of California, many workers face discrimination because they are indigenous and only speak indigenous languages. And therefore, they are taken advantage of due to the language barriers. And we have had some other comments regarding farm workers have said that they feel alone and many do not care about what they do and about their safety. And I can say that's something we've been hearing more and more, especially since the COVID pandemic began. But it's something that's been going on, one could say, forever. And, you know, COVID just brought it into relief for the rest of the country. And also there was a mention of familismo and fatalismo. Familismo is a reference to this cultural value in the Hispanic or Latinx community of strong family bonds and strong family loyalty. And fatalismo refers to the belief that what's going to happen is going to happen, and sometimes there is no way to prevent bad things from happening to us. And then looking at some of the promising practices that you have shared with us, One person said they would like to have more details and tools on promising practices that they can use for their own organizing and for their outreach efforts. And another says that mutual aids have been very beneficial and helpful. Community supporting community, which is one of the ways that Dr. Pagán Santana was mentioning, that those gaps in aid for farm workers are filled by communities getting involved. Also, the use of community health workers, the promotores de salud. And one person comments that the Pacific Northwest Agricultural Safety and Health Center has developed resources and educational tools related to heat-related illness and wildfire smoke for workers, employers, and community health workers. And they put the links right there in the Miro board. So if anyone wants to go back there later and take a look at those resources, we will keep those up. You have also given us multiple recommendations for organizations and government. One of them relates to collaboration with other organizations to create campaigns and create protections in the law for farm workers. Also gathering testimonies of farm workers and highlighting them in news and social media to help shine a light on farm worker issues. As well, pulling resources and ideas together so that we're not always reinventing the wheel. And someone suggested that people can drop accounts to follow in the chat, as well as action steps that they would recommend after the symposium. That would be helpful. And someone said, never assume, which is something very important. Never assume. If we need to know, it's best to ask. And nobody can tell us what the needs of the community are and how to address those needs better than the farm workers themselves. I will also take a quick look at the things that people posted in the Google Doc, so we can get some feedback from those groups as well. And remember, we are going to collect all the feedback, all the ideas and recommendations you have provided, and we are going to highlight those in an upcoming Farm Worker Justice report that's going to be published after the symposium. So looking at the Google document, we have a comment on the pesticides and climate change conversation being impactful, and ask about ideas and recommendations on how they can respond. Someone found the quotes from the farm workers impactful, especially during COVID, where workers were told they are heroes and their jobs were necessary. But their working conditions did not reflect that. And another person reflects on working in the Coachella Valley and the high effects of heat stress. And there is a lot of interest on heat stress and what can be done and what rules other states have. Someone mentioned a recent rule that was just adopted by Oregon last week. And promising practices. So we also have a mention of the Girasole study that the Farmworker Association of Florida and Emory University have conducted on the markers of heat stress, dehydration, and kidney damage in farm workers in various locations of Florida. And I have seen that study mentioned a lot. If you have not seen the data or seen the descriptions of the studies and the findings, it's something that is very interesting for those of you who are working with farm workers. It has good information that can be used in our advocacy regarding heat stress. And for recommendations, someone emphasized the importance of communication. Thank you very much, everyone, for putting your thoughts and ideas on the boards. We're going to make use of that information that you have shared with us. If you have not had a chance to fill out the poll, please go ahead and do so. And that feedback will help us with our future activities so that we can bring more information and more webinars and sessions that are useful to you.